Hi, my name is Dr. David Hindmarsh. In this video, we're going to talk about two things: pre-diabetes and, more importantly, the National Diabetes Prevention Programme. So before we go into that, we're going to talk through what pre-diabetes is. So pre-diabetes is when someone can't handle blood sugar in the way that they should be able to. And there is a risk that if we don't do anything about it, they may become diabetic, more specifically type 2 diabetic. So type 2 diabetes is a condition where your body can no longer lower its own blood sugar to control it into a normal level on its own. This is because the cells that control glucose in the blood no longer react to insulin in the way that they should, or that the cells that produce insulin have sort of slowed down, which can be quite common in aging. And insulin is the really key important one that helps us lower the blood sugar. So we measure this by doing a blood test called HbA1c, and this takes a snapshot of your red blood cells over a 3-month period of time. What happens is that extra glucose and sugar that's sort of in your bloodstream will stick to that red blood cell, and if there's more of it stuck to the red blood cell, then that shows that your body's not controlling it as it should be. If it's below 42, happy days. You're completely normal. We don't worry about it too much. 42 to 47, we consider that pre-diabetic. And then finally, above 47, so 48 and above, you may be diabetic. Now, if it's 48 and above, we might want to repeat the test in a couple of months' time just to see what's going on, or we need to see if you've got any symptoms of diabetes. So pre-diabetes itself can be symptomless, so nothing's happening, and that's actually how we pick up the majority of people that we're doing the annual blood, say if you've got high blood pressure, and we will include that automatically, and it just picks up as a matter of fact. So things that can occur, such as being more thirsty, urinating more, being a bit more tired than usual, and you can get effects on your vision and also sort of some numbness and tingling in your hands as well. And you can be more susceptible to infections, so thinking of this time of year or your coughs and colds. The good thing, though, is that pre-diabetes and diabetes is reversible, or certainly more controllable, okay? And we'll talk about how we go through this in this video. And it's worthwhile thinking, if you're watching this and you haven't had your HbA1c done and you're worried about this, just book in and we can discuss through this in a routine appointment. So why is pre-diabetes and developing diabetes potentially a problem? You may know people with this condition who seem to be doing absolutely fine, and the majority of people are. However, diabetes can affect many aspects of your life, such as your home and insurance, and just think about the non-health related stuff, as well as some quite significant health related issues. So if you think about life at home, depending on how well your diabetes is controlled, you may need to monitor your blood sugar, and you have to do finger pricks every day. And you may need to be on certain medications every day just to try and sort of control this, as well as being conscious and aware of your foods that you are taking. We regularly want to check up on your eyes and feet, and this may revolve extra appointments in separate clinics, sometimes in hospital. And also we just need to be very mindful of how much exercise you're taking as well. You mentioned a bit about insurance, and this is one thing that I'm not sure is really discussed, is that having this condition can affect your life expectancy, and so have a subsequent impact on certain insurance policies, holiday insurance, life insurance. And so we need to try and sort of mitigate that as one of these added bonuses. Likewise, if can affect your eyes, diabetes, as well as being on the medication can affect your blood sugar, and so the impact of both of those may affect your ability to drive. As I said, not in the majority of the cases, but sort of it's these small risks that are quite serious that we can try and avoid. And again, we're going to leave the last bit, the bit that, me as a doctor is very concerned about, is how it affects your health. Diabetes can cause eye issues, and also increase your risk of developing certain heart conditions, stroke, heart attacks, as also nerve problems as well. You've probably sussed out this as quite a huge mental load to deal with as well. So I'm not surprised that actually it can affect your mental health, with high rates of depression sort of reported as well. And also, if the diabetes is not well controlled, it can really affect things like your wound healing, and also in worst cases affect the blood supply to your hands and your feet. However, right, it's not all doom and gloom. Let's, get some positive out of this. So if you're at risk and you've had this video sort of said, please watch this, then you're probably in that pre-diabetic range, and you are eligible for the National Diabetes Prevention Programme. And what we're trying to do, and what this program is trying to do, is prevent you from becoming pre-diabetic into diabetic, okay? Now, it stands for the Diabetes Prevention Programme, and it's sometimes known as Healthier You. If you're watching this from a different part of the country, not Eaglescliffe, then each service varies depending on where you are in the UK, but they all follow the rough same line. So it's a 9-month programme that helps reverse all of your risks. Okay, it states that whoever completes the program would have their risk of developing type 2 diabetes cut by a third, which is massive, absolutely massive. And the benefit of this is that this could potentially save millions of lives. So we want as many people to go through this who are eligible and at risk, so we can prevent the progression onto diabetes. So the 9-month course is designed to be very manageable, to fit in and around people's schedules. So 13 sessions spanning over 9 months, with each session being around 90 minutes, so an hour and a half. It's weekly at first for the first half of the sessions, then drops down to monthly, so you get that sort of initial support. It's done through groups locally, face-to-face, or if you're a particularly busy person, it can be held online. Just contact them and see what they can offer. Okay, programs also held in many different languages, so if English isn't your first language, you're not being disinhibited. Then lastly, for advice on lifestyle, such as what to eat, when to eat, and also thinking about other things that can affect diabetes that you may not have thought of, smoking cessation being a huge part of it, alcohol intake, and also exercise as well. Sessions are also just really good for having a group of individuals who are going through a similar bit, can sort of really help each other out and support, and often that is really beneficial as well. So if you've received this message, what do you do next? You think, yes, I want to do this, I want to change things. If you've had an AccuRx, so a text message on your phone, there will be an ability to reply there. Brilliant. Respond, we'll get you sorted from that way. Secondly, if you're watching this, say, on our YouTube channel or via Facebook, put in an e-consult. That's probably the quickest and easiest, saying, I think I'm pre-diabetic. Okay, please can you put me through to this service? Fantastic, and we'll sort that out for you. Likewise, if you're not sure, you've got a couple more questions, you feel free to book in for an appointment with one of us as a routine appointment. A lot of our nursing staff are fantastic when it comes to this as well, so it doesn't have to be with a doctor, and we can sort of talk you through the pros and cons of it. In short, I think the majority of the staff would say just give it a go, because a lot of these benefits that they're going to talk about will sort of hopefully improve your overall health. So just give it a shot, okay? Dr. Dave Hindmarsh, Eaglescliffe Medical Practice. If you're eligible for the National Diabetes Prevention Programme, please sign up.